The Director General, National Agency for Food and Drug Administration and Control, Nafdac, Professor Mojisola Christiana Adeyeye, has addressed Nigerians on the dangers posed by the growing rate of drug hawking and use of calcium carbide to ripen fruits in Nigeria. Speaking to newsmen at the flag off of the sensitization workshop, she warned that henceforth any drug hawker arrested by NAFDAC will be prosecuted. Clevis correspondent who was at the workshop brings us details of the event. The National Agency for Food and Drug Administration and Control, NAFDAC, has declared war against the troubling issue of drug hawking and the dangerous practice of using calcium carbide to ripen fruits. The DG Nafdac, Professor Mojisola, said there have been clarion calls by well-meaning Nigerians on the need to take stringent regulatory actions to stem the dangerous tide of drug hawking and ripening of fruits with calcium carbide. She said there's a growing concern about the looming danger and health implications of this too nefarious group of unscrupulous citizens in our country.
The menace of drug hawking poses serious challenge to healthcare delivery system in the country. Drugs are sensitive, life-saving commodities which should not be sold on the streets, in motor parks or open markets, just like any other article of trade. I wish to warn that any drug hawker arrested by Nafdac will be prosecuted, will face a jail term, and our enforcement officers are currently carrying out synchronized nationwide operation. We want to put an end to drug hawking.
We have so much to do in this war that we are fighting, because your health, physical and social well-being and mental well-being has to be safeguarded before you begin to talk. Seek it first. Your health. If you don't have good health, that is when you begin to understand what it means when you are not healthy. So the great task we are doing is a war, and we are moving on to the next phase of it.
Speaking on the impact of food fraud and how to identify fruits that have been contaminated with calcium carbide and the long-term effects, the DG and some of her directors gave extensive paper presentation on the subject.
An estimated 420,000 of these people will actually die annually from eating contaminated food, and really these are preventable deaths because the food does not have to be contaminated.
Whether the fruit is going to be beneficial to you, whether it's not going to be beneficial to you, is dependent on how it is ripened.
You can identify such artificially ripened fruits if you notice that the fruits are all yellow, whereas the stem is dark. Naturally ripened fruits usually have brown or black spots, while those artificially ripened have traces of powdery substances and peel off quickly. They may result in cancer, heart, kidney, and liver failure. They may also cause frequent thirst, irritation in mouth and nose, weakness, permanent skin damage, difficulty in swallowing, vomiting, skin ulcer, and so on. Higher exposure may cause undesired fluid buildup in lungs or pulmonary edema. The impurities are hazardous to pregnant women and children and may lead to headache, dizziness, mood disturbances, mental confusion, memory loss, cerebral edema or swelling in the brain, sleepiness, seizures, and so on.
With increased campaigns and enforcement activities, NAFDAC has commissioned a scientific study on the best approach towards mitigating the health hazard posed by the ripening of fruits with carbides. NAFDAC said it is confident of winning the war against the two hydra-headed public health menace.